The Nigerian government is intensifying efforts to produce local vaccines to respond to the multiple disease outbreaks, including monkeypox, cholera, and the growing threat of antimicrobial resistance (AMR) in the country. Dr. Jide Idris, Director General of the Nigerian Center for Disease Control (NCDC), disclosed in Abuja. He highlighted the urgent need for homegrown vaccines to combat the rapid spread of diseases like Mpox, which has seen 39 confirmed cases across 33 states, including Bayelsa, Cross River, and Lagos. He noted that the nation's reliance on foreign vaccines is no longer sufficient to meet needs, adding that local vaccine production is crucial for Nigeria to effectively respond to these outbreaks. The Director General also commended the response team for being at the forefront, stressing that despite the alarming spread, no deaths have been reported, and stressed that Mpox, which is transmitted from animals to humans and between humans through close contact, poses a serious public health threat that must be dealt with decisively. Dr. Idris therefore urged Nigerians to adhere strictly to safety measures to prevent further transmission.
We are also considering vaccination efforts for high-risk groups as Nigeria we're expecting to receive about 10,000 doses of the new vaccines that have just recently been approved for emergency use. A concerted effort by this government to produce some of these vaccines. And the earlier we started doing it, the better for us, because relying on supplies from other countries is a bit of a problem. You know the experience in COVID. The exact reservoir of the virus is still unknown, although rodents, squirrels, and monkeys are suspected to play a part in transmission. This can happen through a bite, a scratch, handling of or eating inadequately cooked and other products of infected bushmeat.
Dr. Idris also called for immediate action to combat cholera as it continues to ravage the country with nearly 6,000 suspected cases and 176 deaths reported as of August 11, 2024. This outbreak, according to him, is attributed to poor sanitation practice, emphasizing the vulnerability of children under the age of 5.
Contributing factors to this outbreak include high rates of open defecation, like we said before, which leads to contamination of water sources through the runoff of fecal matter. The National Rapid Response Teams have been deployed to key 6 states reporting the highest number of cases, and these are Abia, Katsina, Lagos, Bayelsa, Ebonyi, and Zamfara.
Consequently, the silent but deadly rise of antimicrobial resistance (AMR) has also claimed over 64,000 lives in Nigeria. This necessitated the response of the NCDC in launching a multi-sectoral approach focused on public education, responsible antibiotic use, and enhanced surveillance across human, animal, and environmental sectors.
In Nigeria, AMR has over 65,000 deaths, with a particular grave impact on children under 5 years old, who account for 1 in 5 of these fatalities. AMR is driven majorly by human behavior, such as irresponsible use of antimicrobial drugs, lack of laboratory tests before antibiotics are prescribed by prescribers, inappropriate prescription of antibiotics and use, increased circulation of substandard and fake drugs, poor personal and environmental hygiene and sanitation, use of antibiotics to enhance growth in animals, and poor access to quality healthcare services.
Dr. Idris stresses that the potential threats from these diseases can be controlled if Nigeria enhances its laboratory capacity for early detection, treatment, and immediate vaccine production. Partnership and local initiatives are essential to safeguarding the health of all Nigerians. Vincent Okushi, GTV News, Nigeria.